we're going to talk to you about awake craniotomies. I'm going to tell you why we do awake craniotomies. Awake craniotomies are basically done on patients who have brain tumors or any other lesion which is near the eloquent area of the brain. The eloquent area of the brain, by that I mean the part of the brain which controls any particular vital function of your body, such as your speech area, which controls your speech, your ability to speak, and your motor tracts, or your the area of the brain which controls the movement of your body, vital movements of the body. So these are some basic areas of the brain which are supposed to be protected while you're doing the surgery. So it can be done in both with the patient awake. And if the patient is not compliant, then we can do it with neuromonitoring when we do cortical mapping. Now, awake craniotomy patients are actually first assessed by the psychologist whether they can endure that kind of surgery. And secondly, during the surgery, what we actually do is the anesthetist, it's a teamwork. It's not just the surgeon's feat. And before the surgery, when the patient is put to sleep initially, the anesthetist actually puts a lot of local anesthetic around the scalp area, which is around this area, so that the patient doesn't feel anything. Secondly, once the patient's bone is open, we take the bone window out, and before we actually open the covering of the brain, we wake the patient up, and then we ask the patient to do certain tasks. And those tasks are monitored by the speech and language therapy team and also by the neurologists at times as well. Awake craniotomies can also be done for DBS patients as well, deep brain stimulus patients. When we see patients with Parkinsonism who have deep brain stimulations, we can actually do it with awake as well. And you can actually see the movement getting better as soon as we start changing the current in the transmission in the pulse generator or the deep brain stimulation. So awake craniotomy as a whole is a teamwork, and you have to have a good team. The anesthetist has to be on board, the speech and language therapist has to be on board, the neurologist has to be on board, and most importantly, the patient has to be on board, and that has to be assessed by the psychologist, clinical psychologist. Thank you.